Dr. Carlson was great through the whole process. He helped me get over my dentist phobia, and I would not trust anybody else with my teeth.
Dr. Carlson, you have been making people's smiles beautiful for many years now.
That's my favorite part of dentistry. I love aesthetics, loving changing people's smiles. If somebody's not happy with how they smile or their appearance, it can be a life-changing thing.
Well, and typically people who aren't happy with their smile or with their teeth don't smile. So you actually put that smile on their face.
And that's really true. We've had people who don't smile, and we've redone their smile for them, and they smile steady and express that gratitude for the ability to smile.
Isn't that nice to know that you're able to do that? And this is called Invisalign. That's one of the ways you can make a beautiful smile.
Invisalign is a choice for people who don't want to have the brackets on their teeth. The brackets are bands. Mm-hmm. And it's clear trays that through 2-week intervals, they change those trays and they gradually move the teeth into the position that you want the teeth to be in.
So an alternative to braces, and this is a great way for an adult to go, because as an adult we don't want to have those braces on. You can still smile with these, and not people, you can tell they're there, but you really can't tell they're there. You know what I mean?
Yeah, you can't tell they're there unless you're really up close and looking for it. And so it's really nice for adults. It's great for teenagers too. Yes,
absolutely, and the self-confidence it's going to bring. Well, let's show the process a little bit. You have up here on your screen an actual patient.
Right. This is an actual patient, and it's a little bit more of a dramatic case, and so that's why I chose this case. Mm-hmm. And so through the process of Invisalign, it will move her teeth actually that far.
Wow.
And if we do...
You say every 2 weeks they come in and you adjust it a little to where that pressure is being put on.
What it is we take impressions. I was going to show you some, but I don't have any right here handy. And we send those impressions along with pictures and bite registration to the Align Tech, mm-hmm. to the corporation. And they will take and scan those models in of the people's teeth, and then we'll send back to us on the computer a image of where they want their teeth to be. Mm-hmm. And I go through and work that up and see if it's okay, and then that's okayed. And then they will make trays that every 2 weeks that patient will just change the trays and incrementally move their teeth to the end result.
Fantastic. So that before and after is dramatic, and that's what you said. You don't have to have that dramatic of an issue, though, to take advantage of this program.
Oh, no. That's what's nice about Invisalign, is because even if people that want to move their teeth a tiny little bit, it's great. It's terrific.
And it's very affordable process to do, and you also have a payment plan. Is that correct?
That's right. Yeah, it's similar to braces. However, because we are involved with Align Tech, there is a little bit larger startup cost, but then after that it's similar to braces in so much money per month.
Well, there shouldn't be any reason to prevent you from getting this done if you are in that situation, because your face is the window to the world. People look at you, and Alan and I have occasionally, on news programs when they're interviewing certain people, and you think, oh, it's so sad, they're in their 40s and they just needed that work. Why didn't they didn't get that done? And they can still get that done.
They can get that done. I'm trying to think of my oldest patient, but people into their 70s can get their teeth. As a matter of fact, a lot of the people, it's after they retire, all of a sudden they have some money that they didn't have when they had all the children at home, and they're getting their teeth straightened.
Well, I think as a parent it's important to help your kids through that, though, too, because it does help with your self-image, and throughout your life it only helps you with that self-esteem, which also portrays in the jobs, interviews, every aspect of your life is with your smile.
That's right. Oftentimes you'll see someone that will have an attractive face, and you have a good impression, and the person smiles and they've got some missing teeth up front, and all of a sudden it shifts your impression. We shouldn't be that way, but that's the way the way we think often.
And we appreciate that Dr. Carlson here at Hyde Park Dental can take you through this process. So you can come in and have a consultation. I suppose is the best place to start. Come in and talk to you and see your teeth, and you can give them the recommendations.
Right, and tell them the best way to proceed. Another thing I wanted to mention, we talked a lot about adults, and you mentioned children needing that. One advantage of Invisalign for youth, because they're not as diligent in keeping their teeth clean sometimes as adults. And with Invisalign, you take those off so you can brush and floss your teeth, take them off when you eat, and clean your teeth, and then you put them back on.
That's an aspect I did not know, was how you worked with that.
So that's a real important aspect that adults like, and it's real important for youth.
Absolutely, that's going to be long-term better care because you can floss and do everything else that you need to do.
And then you don't end up with the decalcifications and things that you often end up with braces if they don't keep their teeth as clean as they should.
Absolutely, and you're right. Kids aren't as meticulous as we are they?
Right.
Well, get on here to Hyde Park Dental. Talk to Dr. Carlson about the opportunities with Invisalign. Now, you do all teeth care, all dentistry here, but this is one thing that you also offer.
I love it. I love it. I love the Invisalign and the aesthetic aspect of dentistry.
Very good. We'll let your face sparkle and your eyes sparkle with the new smile. So thanks so much.
Thank you.